The major contributing factor of cerebrovascular disease is atherosclerosis. Atherosclerosis is a plaque formation which is formed by fibrin, lipids, complex carbohydrates, and calcium deposits accumulating on arterial walls that leads to progressive narrowing of blood vessels. The most common site for this lesion or origin of common carotid artery are the common carotid artery transitioning into middle cerebral artery and the main bifurcation of middle cerebral artery and the junction of vertebral arteries with basilar artery. The cause for ischemic stroke is thrombus, embolus, or low systemic perfusion pressure. The first one is thrombus. The cerebral thrombus means thrombus occurs at the cerebral arteries or its branches. The thrombus also occurs at extracranial vessels such as carotid arteries or vertebral arteries. It even produces the symptom of stroke. So thrombus, which leads to cerebral infarction, it's called as atherothrombotic cerebral infarction. So the next one is embolus. So the cerebral embolus means it consists of plaques and blood clots which formed elsewhere, but it released into the circulation and it occlude the blood circulation of cerebral arteries. Occasionally, the embolus is formed due to systemic disorders called fat or air or septic emboli, which affects the cerebral circulation. The common culprit, which is the embolus, is formed due to diseases of cardiovascular system. So the next one is low systemic perfusion. So due to circumstances such as cardiac failure or loss of blood leads to systemic hypotension. So, in this circumstance, there will be bilateral neurological deficit. Hemorrhagic stroke, which causes due to rupture of blood vessel, which causes intracerebral hemorrhage. First, we see about primary cerebral hemorrhage, which is non-traumatic spontaneous hemorrhage, which occurs in small blood vessels. So, due to atherosclerosis forming aneurysm in these small blood vessels, causing this primary cerebral hemorrhage, which weakens this small blood vessel. Then, subarachnoid hemorrhage due to saccular or berry aneurysm, which causes bleeding into the subarachnoid space in a larger blood vessel. So, the hemorrhagic stroke causes increased intracranial pressure and restricted distal blood flow. The hemorrhagic stroke occurs in chronic hypertension patients. This aneurysm is formed because of congenital defect which will weaken the blood vessel wall. Atriovenous malformation is another congenital defect that can result in stroke. This AVM is characterized by a tortuous tangle of arteries and veins with agenesis of an interposing capillary system. The abnormal vessels undergo progressive dilation with age and eventually bleed in about 50% cases. Sudden and severe cerebral bleeding can result in death within hours because intracranial pressure rises rapidly and adjacent cortical tissues are compressed or displaced, as in brainstem herniation.